Can I start, sir?
Yes.
Om Gurubhyo Namah. Vanakkam and welcome on and all Vaidyas who practice Rasaushadis and Shishyas who are willing to practice Rasaushadis by Ayurveda Ziksha learning series of I Ask Ayush. Myself, Solai Krishnan Prakasha Abhishek from Government Ayurvedic Medical College and Hospital, Nagarkot. We really need to salute to the people who manufacture Rasaushadis in a correct, proper manner, despite of adultering and delivering a sattvika preparation to the patient and making them well is absolutely a bliss. Generally, fresher doctors who have recently completed their BAMS may have some reluctant on prescribing Rasaushadis. As they are new to practice, they should be careful to prescribe them. As if a medicine is given, if some other irrelevant conditions of rogis, then it may lead to severe side effect to the rogi and legally to the Vaidya who prescribe it. So it purely depends on Vaidya's duty. Let's make it clear. So we invited Dr. Naveen Kodlady, MD PhD IU, on the topic Principles and Practice of Clinical Rasashastram. Let's have a brief intro about sir. Dr. Naveen Kodlady from a small village named Kodlady, Udupi district of Karnataka, has done his BAMS from ALN Rao Memorial Ayurvedic Medical College, Kopa, Karnataka in 2004, and he has done his MD in Rasashastram and Vaishajya Kalpanam from Taranath Government Ayurvedic College, Bellary, Karnataka, and also did his Ph.D. in Indian Postgraduate Training and Research Academy, Gujarat Ayurveda University, Jamnagar in 2010 to 2012, and he also has done his MBA from National Institute of Business Management, Chennai, through distant education, and he has also gone through and worked in Santigiri Ayurveda College, Palakkad, and SDM College of Ayurveda, Hassan, and SDM Institute of Ayurveda, Bengaluru. And currently, he is working as a professor of Department of PG and PhD Studies in Rasashastram and Vaishajya Kalpana at JS Ayurveda Mahavidyalaya, Nadiad, Gujarat. And additionally, he is responsible as the production head in Sundar Ayurveda Pharmacy, a GMP certified pharmacy of JS Ayurveda. And also, he is a 13 years experienced teacher and a 7 years experienced clinical practitioner. And then he has established more than 20 scientific publication journals, including Scopus and PubMed indexed journals. And also, he is doing his well best to the field of Ayurveda. And let's get into the topic without late as soon as possible. Over to you, sir.
Thank you, Abhishek. So, Namaste, everyone. On the eve of Independence Day, my warm greetings to all the viewers of the Independence Day. Principles and practice of clinical Rasashastra. It's very interesting to note that a single ingredient is used in thousands of formulations, and an entire one field of medicine is named after it. Yes, Parada. Parada is used in thousands of formulations, and it's very hard to see anywhere else to have one ingredient being used in thousands of formulations. And entire science is known as Rasashastra. Rasa is nothing but Parada. And it's attributed to the qualities Paradaha Shadrasaha Snigdho Doshakdo Rasayana Yogavahi Mahavrashya Sada Vishnu Pradam. Why it is used in thousands of formulations? Because it can enhance the activities or properties of other drugs with which it is processed. Yogavahi properties, and it's one of the good Rasayana rejuvenative property. Mahavrashya very good aphrodisiac, and it enhances the vision. And यस्य रोगस्य यो योगस्तेनैव सह योजितः रसेन्द्रो हन्ति तं रोगं नरकुञ्जरवासिना. So with the formulations of which diseases which with it is processed, it will enhance the properties of that formulations. That is the property of yoga. So Yogavahi, if you enlist Yogavahi, Tridoshagna. Tridoshagna has a very important importance in the clinical practice. It cannot provoke any other doshas. It's a Tridosha medicine. Rasana Sarvadhatu, another important characteristics. An ability to swallow and dissolve other metals and minerals, and in turn imbibe the properties of that metals. And Mahavrashya, highly aphrodisiac, Rasayana. Drugs are known to be Kshetrasatmaka in Ayurveda. One is Parada, which also is Kshetrasatmaka. So, and Ave Asadhyeshwa api the ability to cure even in the incest conditions. Then what is Rasaushadhi? Rasaushadhi is mercury containing product. Maharasa, Uparasa, Sadhan Rasa, Loha, Upavishals, Sudhavargya Dravyas, Sikata Vargya. So there are categories, different categories of drugs. So it can be any of those formulations, and these are medicines having quick actions, and associated with certain poisonous drugs also. Then the of Rasaushadhi, these are the minimum dose, the easy administration. Then there is a concept in Shuddha Chikitsa Shamayed Vishuddha Shuddhastu Shamayed Na Kopayed. The Shuddha which subsides the doshas and cures the disease, but it should not provoke the other doshas by creating an. So that is the standard of Ayurveda treatment. So the principle of clinical Rasashastra is merely the practice of Ayurveda itself. Then there are criteria by Sangraha, while dosing, Doshyam, Desham, Balam, Kalam, Adalam, Prakatvam, Satyam, Tataharam, Avan. So Sukshma Samikesha Nirupane, Yo Vartate Tiksaya, Khalati, Jan. So these are the factors. Dushyam, Desham, and place of the affliction, then disease or antibody stage of the disease and season. Mandalam is a digestive fire, it's an inhibitor in the clinical practice. So, Prakriti, constitution, Vayaha, age and individual and duration of the disease, age of the individual as well as the duration of the disease. Sattvam is the stamina of the person and Satya, compatibility and Ahara. So, these are the criteria to be practiced while treating the disease. But there is in Rasashastra, there is a verse called Na Roganam, Na Doshyanam, Nachapum Sapadikshanam, Nadeshasya Nakayasya, Karyo Rasa Chikisate. While using Rasashastra, there are minimal attention needed towards the doshas and dushas involvement, gender, place, and season of the disease and treatment. Though the shlokas certainly clear that not to consider these things, it is not so. Even if you do not consider it very seriously, the treatment can be done. The clinical practice can be done. So that is the understanding. So we cannot deviate from the basic principles of Ayurveda at all. Then the ability to cure the incurable disease is one of the characteristics in this Rasashastra, and Rasachikitsa is considered to be one of the Punya Prada. Rasayo Yogino Datte Shuddha Samanvitam Tuladhana Ashwamedhanam Palam Prapnoti Shashwatam. So that much Punya Prada, because because of its immediate results and ability to cure the disease, and where it is very difficult to cure. Then there are certain important consideration to the rasa practice. The important things include dose fixation, administration of correct dose, diluting and mixing issues which should be managed. Then the vehicles to be used, period of rasaushadhi administration. That is also an important factor to be considered. Then safety spectrum. Whenever we use, whether we are using a safe medicine and to a right person or not, that is to be taken care very well. Then patyas and apatyas during the intake of Paradakalpas and management of complications due to the improper Shodhana of Maranas due to apatyas. That should also be known to the practitioner of Rasa Shastra. And ideal practice of Rasa, we should start with the Kshatriya Karuna or the Panchakarma to the person. So then only it should be start. We have Rasa text. Rasendra Chudamani of Somadeva tells Desha Kalha Kriya Matra Sadupaya Rasastata Tako Demucha Vaishabjam Margam Sutas Siddhaye. So all these are the factors to be considered, told by the Rasa text itself. Then the first one is dose, mostly dose in terms of mgs, not in terms of grams. If you are using some powders are herbal powders are usually given in terms of grams, 3 to 6 grams or sometimes more. But while prescribing the Rasaushadis, we must be remembering that it should be in terms of rattis. One ratti is 125 yonch, and not in terms of grams. Maybe 1 rati, 2 rati, 3 rati, 4 rati, like that. So usually below the 1 gram itself. So if it is more than 1 gram, there are extraordinary cases in purposes. Then it should be taken care and prescribed accordingly. Then classical dose need to be known. What is advanced dose and what you are giving? That should be very important, because just because it is given in terms of rati, you cannot give one rati of all the substances. There are some medicines it is less than one rati also. That should be taken care. And child dose, whenever it is administered to the children. So pediatric dose should be very much assessed and given. Vaidya needs to have an idea of ingredients used. That is an important, even in the herbal medicines. without understanding, without having a clear idea of what are the ingredients in it, it may be dangerous sometimes to give the Rasashastra and their safety level and upavishas, the scheduled even drugs. Upavishas are told, so those are to be known and then only distribute them. Arsenic compounds whenever it is there. So then it should be carefully administered. There are some heavy metals like mercury, copper, or arsenic. Such products are also there. Then should be carefully administered. List of drugs having less than one drug. So it is being below 125 mg. So this administration should be taken care very carefully. Rasakarpura is 1 by 64 to 1 by 32. That means it is 2 to 4 mg. So you cannot take it in spoon. So that needs a dilution there. Then Gauri Pashana 1 by 20, 1/20th to 1 by 30th roughly. That is 1 to 4 mg. So there also you cannot take a spoon. So there is a need of dilution. You cannot directly administer. Then Minashila 1 by 32 to 124, 1 by 24 roughly it is 4 to 5 mg. Of course, Minashila is not directly administered as it is. It is in the formulation. Then when it is administered in formulation, there is a convenience. The little higher doses can be administered. Then Haratala again 1 by 4 to half rati. It is also not administered independently. Hingula, that's half to 1 rati. Swarnavasma 1 by 8 to 1 by 4 rati. Swarnavasma is administered independently. So that is very small, 15 to 30 mg of medicine. So it can also be there. Some other powders can be used for diluting this medicine. The suitable powders for that particular disease can be used for dilution. Then Rachata Basma, Tamra Basma below the Ratis itself. Then Lohavasma half to 1 Rati, Mandurabasma 1 by 4 to 2 Rati, Nagavasma half to 1 Rati, Yashadabasma half to 1 Rati, Pittala Kamsa, Vartalohas half to 1 Rati, and Vajrabasma. Vajrabasma, an important basma, very costly basma as well. The Vajra is one of the precious stone. 1 by 32 to 1 by 16, 48 mgs. So then Manikya Vasma, Mukta Vasma, Makaradwaja, Rasapushpa. Rasapushpa is 1 by, uh, so that is half to 2.5 rati. So that's then Swarna Makshika Vasma half to 2 rati, Pitta Vasma half to 1 by 4 rati, Kasisa Vasma half to 2 rati, and Vaikanta Vasma 1 by 24 to 1 by 11. So these are the why I stress upon this. Below this 1 rati, there are certain medications. This has to be administered very carefully. If it is more than 1 rati, the the seriousness, the carefulness can be slightly relaxed. That's all. So the dose in general dose of Rasakalpa, Swarnajarita Parada containing formulations and uh, Vaikranta Jarita Parada, half Rati according to classical Daspanangani. Vachajarita Parada containing yogas, 1 by 4 to 3, that is 31 mg. Then other Parada yogas, most of the conditions, the other Parada yogas is 1 Rati. So Swarna Jarita and Parada Jarita, the Vaikranta Jarita Parada, mercurial preparations are less available in the market. So the general dose would be 1 Rati Parada Kalpanas. Then if you age-wise dose of the Rasasindora, there are pediatric dose of the medicines. We can take one example of Rasasindora itself in Rastarangin it is stored. For 1 year baby, it is 1 by 16 rati, that comes to 8 mg. 2 year baby, 1 by 7 rati, 17 mg. 6 year babies, up to 6 year, 2 to 6 year, there is 1 by 3rd rati, that is 40 mg. Then 12-year baby, it is half rati, it is 62.5 mg. And 13-year onwards, it is 1 rati, it is 125 mg of Rasa Sindhura. That can be extrapolated to the mercurial preparations. But interestingly, as we see the Young's formula, if you apply the Young's formula as a 125 mg as adult dose, the 1 year baby will get 9.61 mg. 2-year baby gets 17.84 mg. Whereas, so if you can just compare, they have a comparative view. So classical prescribed dose for 1-year baby is 8 mg, whereas as per the young formula 9.61 the close dose. Second 2-year baby it is 17 mg. It is if you apply the Young's formula 17.85 mg. Then 6-year baby that is 40 mg. It is 41.66 mg as per the Young formula. So 12-year baby it is the exact the classical dose prescribed Restarangni as well as the derived dose is also the same. So there is a it indicates that in 13-year, if you the dose is slightly increased, if you consider the 250 mg as the standard dose, it will be around 130 mg, whereas the classical dose prescribed is 125 mg. Then Kalpa Prayoga. That is another important administration way, especially in purposes. The gradual increasing and gradual decreasing of the doses. Of course, we find that prayogas in Balatakas, Rasayana Prayogas, such prayogas in Chanaka Samhita also. Kalpa Prayoga is a different kind of proportions. It is not it's a gradual increasing and a gradual decreasing of the dose, especially in purposes is used. Then administration of correct dose by dilution. For example, Rasakarpura, that to be administered is 2 mg to 4 mg. So Shuddha Navasadara 5 rati, Shuddha Rasakarpura 5 rati are dissolved in 60 tolo. 60 tolo is 720 ml of cold water. Then it can be administered in 30 to 60 drops. This kind of dilution may be needed in many of the conditions where we have to give the very small dose. So it may be the dilution of the liquid or some powders. The powders which are indicated in such cases that can be used for the dilution. Then another important thing to be noted is care during the mixing is there. Mixing of herbal and herbomiller drugs, see for the homogeneous mixing should be done. Otherwise, what happens? Basmas may remain in the lower part, herbal material may remain in the upper part, or sometimes opposite also. That can give sometimes lack of intended action. And the thing much more riskier is it can cause the risk of overdose of basmas if it is not properly mixed. So mixing is an important thing while administering the rasaushadis. Then anupatas. Rasakarpur, Rasasindhura, explained in Rastatangani, has been given wide anupatas according to the disease. As I told, mercury itself is an yoga drug. The immediate combination, Kacheli, Kalbi Rasayana, Sagandha Murchana, that is also a yoga drug. Then another Rasajirna, that is uh, Rasasindhura, which is prepared by giving subjecting a long duration of the heat treatment. That it's also a yoga bite. This can be used in any of the formulations of other diseases, along with the formulation specified to that disease. That gives enhances the actions of that disease. So this Rastanagini enumerates a long list of anupanas. For example, in Navajvara, it can be added with Tulasi Surasa and Chiranajvara, Guduchi, Parpataka, Danyaka, Kwatha. So all Guduchi, Parpataka, Danyaka, all these are already mentioned for Jara Chikisa. Along with that, you can add the Rasasindora, Guduchi Surasa, and Haridra Surasa in Prameya. Harida is known as Agraushidi in Prameya, according to Astanga there. Then Ashoka, Bala, Kwata, etc. in Pradhara, Bhaharitaki, Kwata in Ashas, Vachachurna in Apasmara, Pushpandasvarasa in Unmada, Ivetaki, Kwata in Shwasa, the Darharitra Kwata in Kamala, then Lohavasma in Pandu, Sitopala and Sukshmayela and Shilajatu. Shilajatu is very good in Mutra Pracha. So Shilajatu that can be as used as a Nupanai along with Rasasindura in case of Mutra Pracha. Tifla Kwata in Shola, Tipali Churna in Murcha, then Brahadela Kwata in Vamana, then So the list goes on. So the very long list of anupanas just for rasa syndrome. So it indicates that Rasundara can be administered in multiple conditions with the formulation specified in that disease. Then period of Rasaushadhi administrations. There are no specific period mentioned for each and every formulation, but we have to derive this from certain formulations. For example, Arogyavardhini Vati, they have showed Mandalam Sevyata Hanti Kushtana Sheshadaha. If you take it is for one mandala is considered to be 40 days. So it should be administered for 40 days. So by that the skin disease can be. So whenever we have to administer the Rasaushadis, it can be taken care that the, for a certain period of time can prepared and then a gap is given and then it can be continued. That is advisable. So Rasayana purpose for a specific time period, long term or lifelong. For lasagne purposes, very small doses can be given. Precaution preparation of medicine should be considered with regard to the genuinity of the raw material, shodhana, and marana of the process. If it is prepared by self and it is ensured that all process have been taken care, then it can be given for a longer duration of time without break. But if you are there is any trace of suspicion, that is always better we give a break. There is a practically you may think of this washout period. Whenever one is using a market sample to eliminate the remote chances of risk for a long term untoward effects of long-term usage, a gap may be considered ever used for months, whenever it is used for months together and years together of usage. Then the first thing is we have to go for Kshatrikarma. Kshatrikarma is cleaning the body. Shodhana before the Rasaushadhi administration. Kshatrikarma is advised even in Charaka Samhita. Panchakarma is advised for before going for Rasayanas. Even for Rasaushadhi's administration, this is must. Kshatrikatya Nijam Deham Sevetaiva Rasayanam. So, Ayurveda Prakasha is one of the predominant textbook of 17th century written by Madhav Upadhyaya, enumerated the Kshatrikarna, the Panchakarmas as Pachana, Stehana, Svedana, Omanamri. It is not the general Panchakarmas mentioned. Of course, the Sarangani mentions the general Panchakarma procedure itself. So here, Ayurveda Prakasha and lists these five treatments as Panchakarmas. Then another important factor to be known and considered is safety spectrum. Safety spectrum includes the which medicines can be administered without any danger. The most safe drugs, the medium safe, and the medicines which have to be taken very carefully. So if you consider there are certain group of medicines, arsenic group of medicines like Gauri Pashana, Haratala, Manashila, these have to be taken administered very carefully. So including Rasa Karpura, which includes the preparation includes H2SO4, concentrated sulfuric acid, Rasa Pushpa, then these kind of medicines. Mridharashranga, lead compounds. So all these preparations to be taken very carefully. Then there are certain categories of medicines like Tuttha, Gandhaka, Vanga, Loha, Mandura, Abra, Makshika, Rachata, Kasisa, Rasaka. These can be administered, but they are not so dangerous as the highly dangerous group of medicines. Then the another categories like Sudhavargya Dravya, Swarna, Kampila, Navasadara, Ratna, Sikata Varga, so the Dupashana, sorry, Pashanas are there. Gairika, Spatika, Shilachatu, Rasanjanas, all these are the safer drugs which can be administered without any danger. Then, so for a clinical point of view, we must have a clear understanding of the dosharatva of the drugs. So if you enlist them, Parada is one of the Tridoshagna, Vaikranta, Spatika, Navasadara, Gisindura, Hingula, Vajra, Neelam, Swarna, Rajata, Kantaloha. These are the dosha rajas. So this advantage is that it will not provoke any other diseases, any other doshas. So it can be administered safely, of course, carefully itself. Then Vatahara drugs, Abraka, Abraka is Vata Pittahara, of course. Kasisa, Manashila is also Kapha Vatahara. Rasanjana, Kaparda, Agnijara, Naga, so Kapha Vatahara again. So these are the conditions, Vatahara drugs, Pittahara. If you want to select some Pittahara drugs, Abraka is one of the Paramashishiram. It is told to be Paramashishiram. Vedika is a Pittahara. Rasanjana, Kampillaka, then Mandura, Mutta, Pravala. Pravala is so Mukta and Pravala coming under Ratnavar, very Shita Viryatmaka drugs, very good. In very good Pittahara drugs. Then Gomoya, Tamra, Loha, Vanga, Vishada. Tamra is Kafa, Pitta Kafahara. Then predominantly Kafahara include Shilajatu, Rasaka, Gandaka, Kasisa, Haratala, Manachal, arsenic compounds. Then Kankushta, Kampilla, Kaparda, Manikya, then Mukta, Taksha, Gomida, Tamra, Loha, Vanga, Yashada. So this doshaknata of the drugs is important from the clinical point of view. Then Rasayanadi drugs. So Rasayana, so if you go for Russia drugs, we have a long list of Russia drugs, Abraka, Vaikranta, Swarnamakshika, Kaparda, Rajata, Swarna, Mukta, Vajra, of course. I remember that I must be aware that these are intended for the those who are already have the clear understanding of the Rasashastra, Maharasa, Suparasa, Sadhana Rasa, Ratnas, Dadus, all those. So for undergraduate students, we have to have the idea of these classifications first. So I emphasize on knowing these basic classifications first, then go for these. Then Ayushya drugs, Abraka, Vaikranta, Shilajatu, Swarna, Mukta, Vajra. Then Rasayana specifically told Abraka, Vaikranta, Swarna Makshika, Shilajatu, Tutta, Gandhaka, Manashila, Swarna, Tikshna Kantaloha. Then Mratyunjaya, specifically told Parada and Vajra, Gandhaka, and Naga. The Mratyunjaya, so which can win over the death itself. It does win, of course, nobody can win over the death ultimately. So there can be some uh, so there are issues with the fonts. So I can just go with these. That is, there are certain patyas also mentioned. Apatyas. First, we must know the apatyas. So Brahati Vilvam Kushmandam Vetragam Karavellakam Vasham Masura Nishpavam Kunatam Sarshapam Tilam Langonoduktanam Samrachuda Surasavam Anupamamsam Danyamnam Boshinam Kadali Dali Kasi Chakuru Vistam Vidixnosam Tabasham KG. So kindly excuse me for the difficulty in the fonts. So then during the mercurial preparations administration, Guru Vistambi Tikshna Ushna Davya should be avoided. So they have enlisted these drugs. Then comes there is Varga known as Kakarashtaka Varga. Kakarashtaka Varga, which includes Kushmandam Karpati Jaiva Kalingam Karavellakam Kusumbukam cha Karpoti Kadari Kakamachakam Kakarastakam Etad Varjayeta Sapakshakaha. So Kakarastaka with the drugs which starting with curls. So Kushmanda, the ashgar, Karkati, cucumber, Kalinga is watermelon, Karavellaka is bitter gourd, Kusumba is safflower, Karkota is spiny gourd, Kadali is banana, and Kakamachika. All these are drugs to be avoided during the administration of resolutions. So these are the drugs to be avoided. Kakarastaka Vargas. We have a glance of these drugs. Then yeah, it's interesting. Sahachari Phalam. Sahachari Phalam is Sakara Phalam. Sakara Phala is Mango is also contraindicated during the administration of uh, this mercurial preparations, Paradhiya Kalpas, because it is attributed, mango is attributed with Guru Vistambi Ajirnaka. So, according to the Dharmatharmi Gantu, it says Maduram Brahmanam Palyam Guru Vistambi Ajirnaka. Guru Vistambi thing should be avoided in during the administration of Paradhiya Kalpas. Then, so alcohol is contraindicated during the Loha administration. Pushmandam Tilatailancha Rosanam Rajikam Tata Madhyam Amla Rasan Chaiva Tyajet Lohasya Sevakaha. So these apatyas should be strictly avoided. Then patyas also enlisted. It should be snana should be taken daily. Hitam mudga, duddhanam, shalyannam, then shakam, paunarnavam, devi, meghanadam, vastukam, saindavam, nagaram, musta, padmapurini bakshi. These are as told to be pathyas during the administration of Paradhiya Kalpanas. Grata, Saindhava, Dhanyaka, Jiraka, according to another references, Goduma, Jirana Shalyannam, Gabyakshiram, Dadi, Hamsodaka, Mudgarasa, all those. Then there is a specific time period foretold in for administration of this, but it may not be able to follow in all the conditions. But there's a specific. We must have this idea. Pratyushe bakshe sutam pratyam jame tadadime vidya yame matiman asniyat bhojanam kita. So it should be pratyushe in the early morning. It should be taken and following the patyas, and after the dvitiya yama in the second yama, I means after 3 hours the food can be taken. That is the prescription told in Rasatarangi. Yeah, then before that, we must know some of the complications. So, in case of Rasashastra, so it's very interesting to note that Kakarastakas are to be avoided during the Paradhiya Kalpas. But if there is a Rasashastra, they are the medicines. Kakarastas should be taken. But in case of Abraka, Ashuddha or Apakwa, Atasi Bija Kalka should be taken for 3 days. Apakwa Makshika Basma, Kulatha Kwata with Darima Kwata, that is advised. Vimala, Mesha Shringi Churna with Chakra, Tutta Jambira Swarasa, it's advised. Then Rasaka Gomutra is advised if it is complications are there. Gandhaka, Godugda, Gograta Yukta, Godugda. Godugda is the administration, of course. Godugda is used as a Shodhana media also in Gandhaka. Haratala, Jiraka, Sharkara, Madhu, Pushmandas are advised. Then Gauri Pashana, Godugda Visheta, Gograta, or Khanda Sharkara, Karavellaka Swarasa. Karavellaka Swarasa is also again used as a Shodhana media. So it's interesting to see. So Shodhana media are used as the medicines to treat the complications. Then Tankana Jala, Tankana is considered to be very good Vishahara, Chararaja. Kanta Sharkara Vitela Taila Churna. So then Thambra Basma, so Dhanyaka Swarasa Kwatha or Kanda Sharkara or Muni Vihi, Agastya. Agastya is administered in case of Thambra Basma complications. Then yeah, there are some important things. In case there are any positive, so we cannot completely negate that there is impossible to have positive cases. So if there are happens, we must be able to identify that. The heavy metal procure of the medicine should be authentic from the authentic sources should be done while preparing, and beware if the patient is exposed to the association for very longer period of time. If it is taken for a longer duration, so it can accumulate, the toxicity can accumulate, so washout periods can be taken, or uh, a duration or Shamsudana can be considered. And we must be aware lead powder adulterations in culture. That's very dangerous. So this adulteration can cause very dangerous situations in practice source the medicines from the outside. So toxicity symptoms, heavy metals of mercury, lead, copper. So if it is the elemental mercury toxicities, then cognitive or motor dysfunctions, memory loss, neuromuscular aspects. So it usually the CNS as the renal system. Then lead poisoning is the long-term use, the anemia, along with the abdominal pain, constipation, memory problems, diseases. The plasma level estimation can in the clinical practice if you whenever we suspect. Then chronic arsenic poison, including pigmentation changes in skin lesions and hard patches on the palms. In addition to the skin cancer, can also long-term exposure arsenic also the cancers of the bladder and lungs. So these such conditions we must identify this. That is one of the tasks of the clinician. Then there was a reported case of aconite poisoning because of the overdose in Mahashankavati. So of course the Vasanava or aconite is one of the cardiac poison. The symptoms like tingling sensation of the palm and sole and severe sweating which gradually reduce. Such the symptoms identification is can be considered. So diagnose whether it is the disease or diagnose whether it is a part of the treatment. That is very important. Then graduate level, I wanted to just list important action. Abraka is Vata Pittahara, Paramashita, it's a Ayushya Rasayana. Abraka was very well used in the COVID condition. Vikranta, Ayushya, Balaprada, Vrishya, and Vajra Bhave Vikranta. It's a one substitute for Vajra. Vajra is one of Sreshta Dravyas. Then Makshika is also a very good Rasayana drug. It's a substitute for Swarna. Swarna is one of the highly Rasayana drug. So whenever there is difficult to use the Swarna Basma, you can Swarna Makshika Basma. Swarna Bhave, Swarna Bimala is Vatapitahara Vrashya. Shilajatu is Medohara mainly. And again, good Rasayana is Shvitrahara, Kustahara, Amlapitahara, Vibandahara. Pala is Doshagna, Rasaka is Surva Mehagna, Maharasas. Then, so these shloka I want to go in detail. So, Gauri Deja Vata is Ayushya Prada. Then, Makshika Dhatu. Makshika is a very good. Makshika Dhatu Sakalamaya, all these things. Prana Sadhya Sakaram in Russia. Sarva Rasayan agrees one of the great attributes. Shilajatu is also a very good. Sarvatva Gada Kimapahram Alohe Hitam. So it can cure all the diseases. Chedakaram, Vishmanashanam. Then coming to the Uparasas, Gandhaka, one of the important drugs. Gandhaka, Paratona, Raseshu, Paraseshu, is the quotation. So Gandhaka is a very good Kustahara, very good Pashana drug. Atirasana, Gairika Shita variant is also iron containing. Kasi is also iron containing Panduvara drug. Spatika is a Kustahara and Snigdha, Haratala, Kustagna, Rasayana, and even in respiratory there's a good Manashila, good in respiratory as well as Kushta skin diseases. Anjana, Netra, specifically Sanjana. From Kushta is Rechana, Atirechana drug, and Gulma Udavartahara. So it's a Samshuddhi. It does the Samshuddhi, Kushta Samshuddhi. Then Kampilika is again Rechana. Gauri Pashana is the Doshagna. Gauri Pashana, while administration, it should be taken very Here, the dose prescribed is very minimal. So ideally, you should be prescribed on dilution only. So it's one of the most toxic drugs in Rasashastra, Gauri Pashana or arsenic trioxide. We have three arsenic compounds. The Gauri Pashana is arsenic trioxide, Manashira is arsenic disulfide, and Haratara is arsenic trisulfide. So arsenic while administration, especially Gauri Pashana, that care should be taken. The Navasadhara is a very good Vatahara, Jataragnika. It's a salt, ammonium chloride. It will be good in Gulva pH. Then Kaparda. So all these Sudavargiya there, of course. Kaparda is Sadhan Rasa as well as coming under Sudavargiya. So since it is a calcium carbonate, so all these calcium carbonate products are used with Parinama Shula Amla Pitta. So then Vanijara, Dadurvatahara, Girisindura, again Tridoshara. Girisindura is not commonly used medicine. Hingula is Atirasayana, commonly used medicine. Dadara Shanga. So that is also a Kesharanjana Kapahara coming to Sadharana. Then the next is Swarna, the Lohas. Coming to the Lohas, Swarna is one of the important Rasayana. Medya, Buddhist, Spatikara, Vishahara, Vrashya, Tridosha. Swarna Prashana is one popular preparation. So it's considered one of the immunization from the Ayurvedic point of view. Rajata is Sara, Paramalekhana, Laghu, Vatakapara. Then Tamra is Pittakapara. Loha is Panduhara, Tridosha Shamana. Vanga is Vedakna, Ushna. Then Naga is again Atyushna. Then Pramehahara. So even for the administration of Naga, we have to take care that it is procured from the authentic sources. We must remember this. Naga is a heavy metal and it can cause a very dangerous consequences if it is not purified properly and it is not Bhasma is not if it is proper Buddhas are not given. Then Ratnas. Ratnas are the category of medicines which can be safely administered. Maniki is Kaphavatahara, Deepana, Vrashya, Mukta. Yeah, Manikya is an aluminum compound. It's interesting to know we have these dhatus. Shad dhatus are the four Shuddha Loha, then Swarna Rajata, Banu Lohashma. Banu is Tamra and the Lohas, and Sisa, then Nagavanga. Nagavangas are the Shadrohas commonly used. Then Yashada is the later used medicine drug in 14th, 15th century. Medicines. Aluminium is also used in Rasashastra indirectly, not as a direct medicine. We have aluminium in this Manikya, we have aluminium in Abragabasma also, silicates, and aluminium in Potashala, that is Spatika, that is also aluminium. Then Mukta. Mukta Pravalas are very good in Amlapitta conditions. Pravala Panchamrita Rasas, we have which contains Chakka Shukti Varatika and Mukta Pravala. So it's one of the very good medicine in Amlapitta conditions. Then Taksha is a Bhoja Vardaka, Kafapittahara is Pushparagam, then Vajra is Mratyunjaya, the attribute is C, Mratyunjaya, which can overcome the death itself. Of course, it is not overcome, it is that attribute to it may be exaggeration, but there is a seriousness we consider the coming looking to the action. Then Ayushya, Sakalama Yagna, Trigoshahara, Russia, and Neeli Shwasaka Sahara, then Gomira Kapitana. So I think I'm taking a long duration of time. So I'm just trying to wind up. So there are these are the for the undergraduate level. I just wanted to bring about the attention. What are the actions of these drugs? Then there is a scheduled event. Sorry, essential drugs list from the Ministry of Ayush. 277 Ayurvedic formulations are there. Among them, there are around 65 Rasaush series are mentioned. We are just looking at some of the important Rasaush series in there. So this Prabhakaravatis and Rajapravartani. Prabhakaravati is attributed with Sarvar Radhaya Akila Rogam. So all kinds of Radrogas it is indicate Prabhakara Vati, Rajaprabhatini Vatis, then Sanjeevani Vati. Sanjeevani Vati is a very good medicine in case of Mandagni, Ajirna, and Jwaras. So it contains two Vishadravyas, Ballataka as well as Rasanada, should be prescribed carefully. So then Vishamusti Vati, Vishamusti contains Kopilu. So it should be administered better to avoid hypertension and tachycardia, even if it is to be administered, they taken care issue because Natsomika, Kopilu itself it causes the tachycardia as well as hypertension. So should not agree with the condition. Then Vetumaran. Vetumaran is the Hingula containing product. It is more popular in Kerala, Sahasra Yoga preparation. So it's a Jwarahara. Then Makaradvaja Rasa Sindhura. Sindhura is one of the ultimate yoga vayu which can be used in all the conditions in a smaller doses. Then Panchamrita Parpati. So if you consider the four important categories of medicine, Sarviya Rasayana, Parpati Rasayana, Kukipat Rasayana, and Portal Rasayana. So Chaturveda Rasayanas. Panchamrita Parpati is one of the important Parpatis indicated in Grahani. And Shweta Parpati. Shweta Parpati does not contain Parda and Gandhaka, so it is Nirgandha preparations, and of course, not Para, no Parada also. It is indicated in Ashmari Mutra Kachra, very useful medicine in the clinical practice, very good in Mutra Kachra. Mukta Pisti, Pravala Pisti, these are Shit Mano doshas. So Manika Vikara is also is good and along with Amla Pitta. So then there was issue in the internet speech, so that's why the slide change was taking little uh, delay, delayed slide change. Kindly excuse me for that. Then Lagumani Vasanta Jirana Jwara, so it is containing Yashada Basma. It's used Lagu Suta Shekarasa, one of the very good medicine in Shula, Parinama Shula as well as Pitta Shura Shura also. That is a Amla Pitta and Shira Shula is closely connected. So Lagushekara is good in GIT as well as in Shira Shula conditions. Then Rasamanikya, Haratala the patient, Kusta, Shankhavati, Vasanava containing products, very good medicine in Agbibandya and Shirana. Shirashula, the Vajrasa, one of the wonderful drug in Shirashula, then Shwasakuthar Rasa, Shashkuta, and Shwasakas Chintamani, which were widely prescribed during the COVID times. So, one of the very good medicines in Kasa Shwasa. Shwasakutari contains Vasanava, it should be noted. So, Vasanava is a very good Jwaragna drug and very good Pachana drugs. So, but it should be taken care that we must have the idea of ingredient use. That is one important thing. Smatisagar Rasa indicated in Apasmara and memory loss, Manashila containing product. Libonakiti Rasa again contains Vasanava. So it's a very good Juragna drug. Vata, Vajagnisha Rasa, Gradrasi, and indicated in Apabahukas. These are some of the drugs which are mentioned in essential drug. So it's an important essential drugs. These are the important drugs in clinical practice. That is what is depicted. Abraka Basma, we already discussed. Then Godanti Basma. Godanti is Shirashula and Jiranajvara. Godanti is one of the very good antibiotic drug from the Rasashastra. Godanti Basma. And Hajrul Yehuda Ashmari Mutrakachra and Jawar Muara Basma, Radroga, Asha, Tapitna, Kapardika, Paranamashula, all Sudavargas, Shankabasmas, Kaparda, so all these are Paranamashula, it's a good. Kasisa, Pandu, Mandura Basma is again Parana, Sornamakshik Basma, Pandu, Jiranajura, and Datukshayas. What a wonderful medicine. Shankabasma, Agnimandia as well as Paranamashula. Then, yeah, we have to have this idea of big weapons in Rasa Power. So, Apraka, Gauri Tejaha, Paramamamritam, Amritam, told to be ambushed, Paramam. Shilatu, Shilajatu, Rasoparase Sutendra, Ratnaloheshu Yeguna, Rasoparasa Sutendra, Ratnaloheshu Yeguna, Basanti de Shiladhatu, Janamritiva. So, Shilajatu itself contains the properties of all rasas upasithas. So that is the Jaramatyu hara, like that exaggerations are there. Of course, it's one of the important tests that is to be taken. So we should not go with the shabdarthas. So we have to grasp the important arthas from that. Then Gandaka Parato Nasti Raseshu Uparateshuma, one of the important drugs. So it is one of the common codes when Parada is used. Then Swarna is one of the important rasayana. Sarvaushadi Prayogeshu Vadayu Nagatayi Karmavi Panchavischapa. Even when Panchakarmas fail, you go with the Swarna Karmas. That is what is told in Ayurveda Prakasha. Ashalas Gadavigraha also we get the similar reference. Karmavi Panchavischapa Suvarnam Tishu Yoji Shilajatu Prayogescha Tapya Sutaka Kastata. Even when you Shilajatu Prayoga Tapya is Swarnamakshaga, Swat Tapya Suta is Parada fails. You go for this Swarna Prayogas. Anni Rasayaneshcha Prayogo Emna Uttamaha. One of the best drugs Swarnas. That we have Brahadvata Chintamani Rasas, Makaradvaja, Purna Chandrodaya, similar drugs. Then Vajra. Vajra is also a big weapon in Rasashastra. Of course, it's one of the costly medicines, even used in cancer treatment. Yogavahi, the similar two important qualities is also Shadrasatmaka, it is also Yogavahi, like Parada. Then it is Vrashyam, Mahayushyam, Netryam, Bandyam, Tridoshakam, Varanyam, Medyam, Vishesha, Vividamayagnam, Sudopamam, again, Sudopamam, Amrutopamam. So it's Pratyunjayam. So such attributes are there. So these attributes clearly give the indications that where we can use, what are the importance or the level of use which can be. To conclude, the essential aspects to keep in mind during the chikiৎসা, dose has to be taken care, the minute dose. So we have to fix the minute dose and administer the minute dose. That is an important thing. Then quality of preparation, whether the Shodhana Maranas are done properly or not, that has to be taken care. If Shodhana Maranas are not properly done, that is can risk the patient. Then duration of administration, there may be differences of opinion, but personally I opine that whenever a subject is taken for a longer duration of time, it is better to give a break. So this can be looking into the bala of the patients and the severity of the disease. So that is to be taken. Then age group in the pediatric doses has to be assessed. Of course, we do not have much references for the separately pediatric doses in Rasashastra. So there's Rasasindura we have specifically in the Sutangangani that can be extrapolated in other conditions as well. Then Patyas and Apatyas, those has to be taken. Then Kshetrikana, whenever if we can do the Kshetrikana and go with the treatment, that is the wonderful and that is the best way to go for the reserve studies. So with that, I conclude and I thank you, the organizers, especially Dr. Elanchale and Dr. Abhishek. So also for giving the opportunity and IAS group, so team for giving the opportunity to present in this platform. Thank you.
Thank you. Thank you for the wonderful session, sir. The session was really awesome, sir. And
Thank you.
you also said well about Maharasa, Uparasa, Sadhana Rasam, and Sudhavarga, Ratnas, and Vishas, and very prominently, very nice, sir. Then you also shared about some formulations which can do magics in the field, sir. Shall we move on to the depth session, sir?
Yeah, sure.
Sir, for a doctor who is practicing, should he prepare his own medicines for his patient or should he buy from the other companies, sir? What would you prefer, sir?
Yeah, that is a important aspect for the clinical practice. It depends on the physical because doctor has to focus on manufacturing as well as clinical practice. May be difficult sometimes. Practically, we have to think. If it is possible, that is wonderful. So even in our hospitals, we use our own medicines. The results are much assured in our. So because we prepare, we do the Shodhana, Marana, and processing, and the drugs, shelf life of the medicinal plants are very important to be taken care of. because there are prescribed shelf life. So it should be used within that time. Otherwise, it may not give the expected results. So if you can do it, prepare and practice. That is the wonderful thing. If it is not, procure from the authentic sources.
Okay, sir.
Yeah.
Sir, then many drugs and vegetables are used for purification, right, sir? For
Yeah.
Shodhana and Marana. But nowadays, most of them are adulterated with pesticides and more, sir. What is your choice, sir?
Yeah, that is it's again the similar problems, of course. Uh, Either we have to manufacture organic cultivation can be planned. If rasa preparations are done, so we can prepare and use any at least important bhavana drug. We do not use much for the bhavana drug. We have the idea of maybe tulasi, maybe datura patra or nirgundi. So these things can be cultivated organically and used. So that will not be much problematic. That is the better thing is to do.
Well answered, sir. Thank you. Sir, if a patient gets intoxicated because of a medicine, then
Yeah.
how should we face it legally, sir?
Yeah, that's an important thing. So there are some proofs to be maintained. So the prescription proof should be there, and if it is from the medicine itself, if it is, we have to accept it. Then we have to give the solution to the patient. That is the responsibility of the physician person. And a proper prescribing and the follow-up prescriptions, all of the documents, the medical legally they are the documents, and if it is confirmed from the serum plasma analysis, if it is some toxic, so because of the medicine itself, so then it should be accepted and it should be the patient should be given the service and the care.
Thank you, sir. Sir, what would your advice to a newly graduated BAMS doctor, sir?
Yeah, newly
That's
graduated
because
BMS.
you are in the position of a role model. So, what will be your advice, sir?
Yeah, the first thing is to read the text thoroughly, because what happens is if you haven't studied the classical textbooks, maybe Bharatrais, Lagutrais, or the Rasa textbooks during the period of the graduation, you have to start it if you are going for the clinical practice. Because the best teacher, best advisor for anyone is the classical textbook itself. You have to go with the classes, then continue the practice. So you will get multiple ideas with the textbooks itself. So be a friend of textbooks. That is my advice.
Sir?
Yeah. Yeah. Am I audible?
Yes, sir. Audible, sir.
Yeah, that's what. So go with the textbooks. So go with the classical usages. That is my advice for the graduates. And of course, it is not only clinical practice. One avenues, different avenues. If you are going for the post graduation, go with the again. I will suggest to go with the classical ones, because if you go through the entrance examination question papers, they are mostly from the Charak Samhita, Sushita Samhita, classical texts. So go with the text if it is possible. If you can understand with the original commentaries of Chakrapa, any other learners, that is wonderful. Otherwise, also you go with the textbooks, read the textbook, the original textbook. That is from my humble advice to the graduates.
Thank you. Thank you very much, sir. Shall we move on to the conclusion, sir?
Yeah,
Sir, we know that we should say about the importance of Rasashastra medicines, sir. For example, limited dosage will have a rapid result, as especially the patient will have the palatability of astringent taste and bitter taste. Our Rashastric medicine, most of the medicines will be of colorless and tasteless. So it will do magics in patients, sir. And we, the Vaidyas, need to promote the Rasa Aushadhis and to have wonders in patient results. I hope many Vaidyas will get a clear-cut vision on prescribing Rasa Aushadhis after this session, sir. And in spite of I ask Ayush, myself, and wishing you all Happy 75th Independence Day, sir. Wishing you all India's 75th Independence Day. And thank you all. See you soon. Stay tuned.
Thank you.
Vanakkam.
Thank you. Independence Day greetings to all. Namaste.